If you watched the last video, you realize that a lot of people with hip flexor pain, syndromes, or tightness can't actually spiral the hip. They can't move in the other direction. They can only go forward and backwards. So we're going to expand on that last video, and we're going to go to a standing variety of the same exact thing. I call this a standing good morning. Some people call it an RDL. Either way, we're driving down like this, and we're going to spiral then later on in another video. Enjoy.
Now going into the standing variety, we can call this good mornings, we can call this Romanian deadlifts, obviously without weight. People call it a few different things, but for the most part we're doing a hinging pattern. We call it a hip hinging pattern. The knees are slightly unlocked. She's driving her hip back towards the window in this case and keeping her feet glued to the ground. Her chest is then coming forward, and we're keeping the same position of the spine, keeping the same posture as she should have when she is seated, also when she's standing upright like this. Now we'll do a little bit of a close-up so we can see that backwards hip displacement, okay? The knees are not locked, and she's pressing her hips back, still keeping the spine in proper position. She does have a little bit of a sway here as well, but again, this is just her typical movements. We'll clean that up.